Hello, everyone, and thank you for joining Ask a Care Navigator Mondays with Maureen. My name is Maureen Williams, and I'm the Director of Care Navigation here at Four Seasons, the Care You Trust. And we try to create this space on most Mondays to talk about issues associated with living well and aging well, and perhaps how Four Seasons may be of service. If you have any questions or comments, you can drop them into the comments box from whichever platform you are viewing, or call us at 866-466-9734, or please go to our website, which is fourseasonscare.org. Please spell out the number 4, fourseasonscare.org. Lots of information there, and we're happy to help you. And I'm delighted to share my gratitude to the Van Winkle Law Firm for serving as the title sponsor of this program, Ask a Care Navigator, Mondays with Maureen. I'm so grateful for their support. The Van Winkle Law Firm is one of the most well-established and respected law firms in the state of North Carolina, providing exceptional legal representation to individuals, families, and businesses in personal law, business law, commercial law, and also estate planning matters. Happy to assist you with that. For more information, please go to www.vwlawfirm.com to request more information or schedule a consultation. And thank you again. Well, I've been getting a lot of queries lately about where to live for mom or dad or people calling me for clients. I'm planning where I'm going to live. So I thought I'd just share an overview from Aging Resources, actually, of senior housing options, okay? Of course, many people want to live in their own homes for the rest of their lives. That's the ultimate in senior living. That's how we all want to do the rest of our lives is in our own homes. But sometimes many people determine it's time to move into a community that's specifically designed to fit our needs as a senior. So there are 3 types: independent living, assisted living facilities, or nursing facilities. So let's unpack those a bit, okay? And by the way, you're not just looking for a roof over your head. You want to make sure that wherever you move to has the facilities, the staff, and the services that meet your needs and expectations, not just for now, but into the future. So that's why it requires some planning and thought. Let's talk about independent living, first of all. As its name implies, an independent living senior community is a community of apartments and or single-family homes where people live independently. The residents don't need any help. Typically, their age is 55 plus. Sometimes that starts at 60 plus. But they live in their own homes, be it an apartment or an independent home, without assistance. No assistance required. Some of them are buy-in options. Some of them are rental options. And some communities offer both choices to live there. Many of these communities provide special amenities such as scheduled social activities, transportation to and from appointments, recreational facilities, housekeeping and laundry services, as well as full-service dining. I hear a lot about the dining. While these are not licensed to provide medical care or home health care, those services might be embedded within the community and offered by another provider, or certainly anyone can pick whatever services they want to have come into their independent home. And by the way, independent living services for seniors might also be called congregate living or retirement communities. Then we have assisted living communities. And in North Carolina, that can refer to state licensed adult care homes or state licensed family care homes, and even non-licensed multi-unit assisted housing with services. That's MUAH. I know that's a mouthful. Multi-unit assisted housing with services. That's what they could be called in North Carolina. These kinds of adult care homes, and typically it may have fewer beds than assisted living facilities, the adult care homes. They do offer 24-hour supervision and assistance to the residents. These communities, all of these types here under the assisted living category, are licensed by the North Carolina Division of Health Service Regulation. Okay, they will provide meals, housekeeping, personal care services, medication supervision, supervision and management, and even nursing services as needed. They'll also provide transportation to and from appointments. Family care homes are also licensed by the state. They offer 24-hour monitoring and supervision, meals, and personal care to residents. Family care homes are not required to have nursing staff on site. Caregivers may generally live on site. That adds to the family atmosphere. And while there may be a choice of healthcare providers coming into the building, residents are always free to choose whomever they wish to provide their health care. Many of these establishments offer a full schedule of activities and on-site opportunities and even for off-site events. And a few even have special wings for dementia care. And you need to know, though, just because an assisted living community or facility says it has a memory care unit does not guarantee that the staff is well trained to manage the special needs of people living with dementia and the state of art activities that they need. So be sure to ask lots of questions and about staff training and programming. Assisted living facilities might also be called rest homes or homes for the aged. You might see those designations as well. Just it's important to know whether they are licensed and registered and exactly which services are covered in the fees that you'll be paying each month. All right, the third type of facility or community, senior community, is called a nursing home, or sometimes they're called skilled nursing facilities. And these facilities are licensed by the North Carolina Division of Health Service Regulation, and they offer the highest level of residential care. They are the right choice for short-term rehab after an illness or disability or recuperating from an accident, and they're frequently the best choice for people who are living with a chronic illness and need long-term care. In addition to the beds and the bed and the meals, the room and board, nursing homes will provide around-the-clock monitoring, personal care, nursing care, rehabilitation, medication management, and social work activities. Most will offer a schedule of social activities and other opportunities like that. Well, then there's a special category called continuing care retirement communities, they're also known as life plan communities or life care communities. These communities they're also called CCRCs, continuing care retirement communities. They offer all three levels of care: independent living, assisted living, and nursing home or skilled nursing care. Typically, these communities require a buy-in fee or entrance fee, and that way residents are guaranteed the level of care that they need at a regulated rate for the rest of their lives. Continuing care retirement community. Most CCRCs require that residents be able to live independently at the time of buy-in. Did you hear that? At the time of buy-in, not at the time that you assume occupancy. Look at the details. You really need to understand the terms of the contract you're assigning. There's several kinds of contracts, from where you buy in for the rest of your life at one rate, some that are modified, some that are fee for service, and there are even equity buy-ins where you actually own your property, your condo, or your home in these communities. There might be rental contracts, but look at the contract details carefully, and it is highly recommended that you bring that contract. Oh, and you want to bring the disclosure statements, the community's disclosure statements. So bring the contract that you're being provided, that you're looking at, and the community's disclosure statements, and take it to an independent third party. An elder law attorney is a great recommendation, or a CPA who can review these documents with you. You want to make sure you know what you're buying into. So if you're looking at a senior community or senior housing, do your research. Do your planning. Ask questions. Ask to come in and dine with some current residents, or ask to spend a weekend there, or even up to a week in any community just to get used to it. The more you do your research, the more you ask your questions, the better choice that you or your loved ones will have and be able to make. So if you want to know more from a regulatory perspective about assisted living communities, you can go to the North Carolina Division of Health Service Regulation online, okay? To know more about nursing communities, Medicare has a 5-star rating system in comparison of the various facilities. And you can go to medicare.gov for that and search Nursing Home Compare. And interestingly, in the state of North Carolina, according to the North Carolina Department of Insurance, Entrance fees for CCRCs can range from a few $1,000s to more than $1 million, with a typical entrance fee ranging anywhere from about $68,000 to $370,000. Then monthly fees for CCRCs can range from $1,000 to up to more than $8,000, but typically it's between the $2,000 to $4,000 category. So you need to know that the North Carolina Department of Insurance publishes a CCRC reference guide, and you can access that at the North Carolina Department of Insurance website. It's a lot. Think about these things carefully, and you need to know that there are companies out there that will offer to help you do some of this for free to you, but you need to know that they're getting a fee paid by the companies that they'll be bringing to you. So there's a money exchange. Care managers and care navigators such as myself, we do this regardless. We do not accept referral fees. So we're doing it for what's in your best interest and not in our pockets. So just wanted to let you know that. There's a little bias there on my part, but you want to make sure it's what's best for you. All righty. Well, this episode you're viewing on Monday, July the 6th, 2026, and I will be away on medical leave for some time. But join us at these times because we're going to be broadcasting and sharing some of the more trafficked episodes that I did last year that are still pertinent and that still might provide you some assistance as you consider how to live well and age well, either for yourself or for your loved ones. So stay tuned. I'll be back with you sometime in August, middle of August, probably. Thank you so much, and give us a call, 866-466-9734, or go to our website, fourseasonscare.org, for more information. Thank you so much. We really appreciate your support. Bye-bye.